Dear friends and colleagues from patient organizations, dear members of Screen Pro project, I'm very happy to be here, and I would like to thank to Professor Češka for a great opportunity to introduce here our Czech patient organization Diagnoza FH. I will speak briefly about Diagnoza FH establishing in 2014, about our goals and aims, about our committee members and volunteers, and finally about the most important issue, our activities for FH patients and broad public. Interestingly, the first idea to start up the organization for FH patients came from the doctors. Specialists from the Czech Society for Atherosclerosis had experience with successful patient organization working abroad, and they connected this experience with the opportunity and unmet needs of patients in Czech Republic. Diagnoza FH was established in autumn 2014, and it was really a big challenge. Although establishing of non-profit organizations is in fact easy in Czech Republic. Formally you need only the name, 4 committee members, official rules and address of the residents. It's important to say that year 2015 was the period of the great expectations in lipidology. PCSK9 inhibitors was coming to European Union, and to get support of industry was easier more than ever. So we convinced the industry and gained the grants for the rise of our patient organization. This industry support persists to these days as a part of social responsibility. I would like to speak now about our aims. First, we would like to care about the needs of FH patients and their close family members. We offer treatment, counseling, or lifestyle and diet advices. We are ready to negotiate with stakeholders. Second, we raise awareness of cardiovascular prevention. We educate the people in primary prevention. And finally, we are in touch with healthcare professionals to share the knowledge, experience and actual needs of patients. Good to say that in Czech Republic is established a dynamic network of more than 60 special centers focused on FH treatment. They are so-called med-ped centers. About our members. To get the first members was quite tricky. We learned that people are generally a bit suspicious, more likely passive than active, and they prefer to be hidden behind the email address and only consume the information from us. But I know that other European PO for FH patients have the same problem with members' activity. But finally, in 2016, first TV spots, articles in press and great support of med-ped network doctors helped. Today we register more than 250 of members which are interested in our activities. As for member staff, we have 2 staff, that's me and my colleague Zdeňka. She is a chair and she is a FH patient. I am a vice chair and I am not FH patient. I'm originally a medical journalist, and I am responsible for budget planning and for all projects developing. And nowadays we also have 2 volunteers which are ready to help us with our projects. We really cannot reach our goals without Czech Society for Atherosclerosis. It teaches us about FH and current treatment. It helps to find new members, or it checks our learning materials. So many thanks to them. What we do, it's a very important chapter. We realize annually a few activities for our members and for the public. First, courses about FH diagnosis and therapy and about healthy lifestyle and diet. FH Awareness Week in September, it is the biggest campaign for public. We also realize press conferences about cardiovascular risks. And in this year we launched Instagram, Facebook and YouTube campaign focused on teens. I will speak about it in next slides. We also print brochures and learning materials for patients and for public. Now a few words about FH Awareness Week, the biggest campaign for public. The first FH Awareness Week took place in Prague in September 2016 at the occasion of FH World Day. Our FH Week is generally focused on screening of high cholesterol levels and public education in big organizations, firms and institutions. Our team of nurses, doctors and nutritive therapists checked and educated more than 1,900 people since 2016 till this year. More than 10 people suspected of FH have been detected. We have delivered more than 2,000 brochures and leaflets about cholesterol. The part of FH Week is also a press conference about our screening data and generally about FH and risk of high cholesterol levels and about atherosclerosis. Looking back, I can say that management or top management of addressed firms has been very open and excited. We have had great conditions for our week there. I mean that preventive healthcare campaigns become to be a new trend in Czech Republic and in firms in Czech Republic. Here you can see a few photos from our FH weeks. You can see doctors' education, nurses and measuring of lipid panel. We know that it's very important to be in touch with our partners and our members. So we every month send electronic newsletter to our members and partners about important news. And every 6 months we print FH journal with articles, interviews, personal stories about diet plans, invitations, etc. Here you can see our FH journal from last year. And here you can see the latest issue of FH journal. In the summer we also launched our new websites. They are very modern, easy and more user-friendly. Here you can see our diet plans for FH patients. They are very popular between our members. And here you can see our brochures, how to fight against high blood cholesterol, how to buy food in supermarket, how to read the labels, and many other useful things. Here you can see our brochures about FH for newly diagnosed and for close family of our FH patients. There you can see brochures for teens with FH. They rised up from cooperation with Heart UK organization in Great Britain, and they are very, very nice. We are very proud of them. In left corner you see brochure for parents of FH children, and this brochure is about that statins are a safe option for your child with FH. Next year we would like to prepare big posters and leaflets about diet recommendation, what to eat and what to eat less and what to eat more. You need to be seen in TV and Max. It's very good for your PR and for sharing your messages. So we often visit TV and we are always in touch with medical journalists and other journalists. Very important is involved Instagram and YouTube to address young people. We launched this autumn Insta campaign for teens with FH because about 2/3 of young people with FH or similar conditions stop visiting the doctor when they are 18. They disconnect pediatric care and don't continue with the subsequent treatment, and it's very bad. We made 2 short Instagram and YouTube videos with the influencer, skateboard world master Maxim, because he's able to make young people to listen. He speaks about the health as a priority and about importance of preventive checks, and he is a very credible man for young people. I'm very looking forward to the results of this campaign next year. We are not perfect, so what we should to do next year or next 2 years, we need to find new volunteers and colleagues, we need them, but it's not easy. FH is a silent condition for a long time and patients don't admit this disease, they don't care about this condition. So our members prefer to be rather passive. We know it, but we know it is a problem also for many other SPOs in Europe. Second, we need to find new donors and partners outside pharma industry. To have more sources is always better for you. Better fundraising could cover new activities or part-time staff. We also need to reach the change in the Czech healthcare system together with other organizations, with other powerful organizations. We need more effective treatment for more FH patients, but we know that it's a long time run. We are a small and young patient organization. After all, I would like to share with you some interesting tips and experience. So what we learned between 2014 and 2018, you need good, responsible and loyal team working with the heart. But you also need a reward, appreciation and time for your relax. Don't hesitate to ask for advice. Many people have more experience than you and they kindly help you. Keep your eyes open. And educate yourself. We can recommend, for example, international EPF leadership course for patient organizations. Here you can see a web address, or you can find any local course in your country. Share your experience and build the relationships with patients, doctors, donors, partners, politicians, etc. But on the other hand, don't trust the politicians so much. Be seen on TV, Facebook, Twitter, Insta, in press, and be a reliable, professional and independent partner for all. Dear friends, thank you for your attention, and if you want, don't hesitate to contact me on my email address.